So Nicole, John, thank you for coming today. So we are gonna just quickly record you a quick video just to share for you to share the story about your feet and what initial problem that you came to see me with your mom at that time that I'm not sure you remember, you had a complaint of the very painful bunion, right? On your right foot. And we just talking about just a custom orthotics, and come to find out upon my evaluations that you have extreme flat feet, very flexible, and that's this condition of the bunion is bother you and it's give you a lot of discomfort when you wear shoes when you play sport, right? And that is a kind of like initiate the whole process of why you coming to see us to get find a solution to take care of your feet and at least like walking or running around with no foot pain, right?
I was pretty miserable. It was a lot of pain. It was hard to do the things I liked.
It took us a few times just to think about the process because what you and your mom came in, you just think about, oh, orthotics, or maybe just bunion surgery the most. What never thought about that is a solution that is actually put a stent on your ankle joint and then be able to realign the whole entire joint itself. And there's also work on the other foot, which is not really a lot of problem compared to the right foot. The left foot is kind of a mild case, but the same condition is also happening with the bunion itself forming. So what happened was the right foot is being compensated for so long. So that's why it's forming the bunion, which is the bump, and the toe, every time you walking, the toe not be able to bend properly, then that's when the pain happened, when you're in your shoes. Right? So when you're at home, you complain to your dad, right? So what's your complaint?
It hurt.
It's hurt. Yeah. Yeah. So most of the time, the patient come in without knowing what actually the underlying problem. So we be able to find that out through the X-ray, and we see that her ankle joint is completely collapsed when she's standing up, and that is create the compensation on the front of her foot that's deforming, which is the bump, which is a bunion, and the hammer toe is bending. Okay. So can you share with us how was the process like with the procedure on that day, if you remember?
That day, we came in, it hurt, like normal. We did the procedure. I was asleep, felt good, and then I was able to walk out in the boot, and it was good.
Yeah. So what we did at that procedure is done in the office, that you be able to take the oral medication. It's Valium, it's a kind of calming medication, and you sit on the procedure chair and we numb up your foot where we worked on around the ankle. Next thing you know, you went to sleep. So to continue what we did, we actually make a small incision, which is so tiny, like you can see it right now, and we'd be able to put the stent in and be able to fit the stent in a proper position, so you'd be able to kind of like realign the whole entire joint itself. So now on the right foot that we were about like 3 months out, correct? Yeah, and then the left foot is about a month and a week out. So how do you feel so far with the right foot first?
The right foot feels really good. No more pain. Feels a lot better.
So the real test is when you get back on your game.
Yeah.
Right? With you walking on the cleats and everything, right? So that will be the real test. So Dad, so when she's at home doing the recovery, so what is she like?
Well, the first couple days is probably the worst, because she's unable to walk without the boot. So it's difficult to lay in bed with the boot or sit in the couch and recline with the boot, But after that, it's the swelling goes down, the ibuprofen starts to work. I think as in most cases, right, it's better to get up and start moving as opposed to just keeping it immobilized. And she was able to do that and progress.
Yeah.
And when we took the pictures and she stood, over here, and she was facing the wall, and we saw the back of her feet, you could clearly see how the right foot was already lined up where the left one, before the procedure, was still bending out.
Right.
So you could see already that there was some type of arch that materialized on the right foot, where the left foot was still flat.
Collapsing.
It was definitely hard to be out of activity, to do things, to be in the boot, but in the long run, it definitely helped. So it's definitely worth it.
Well, Dr. Nguyen took care of her older sister. My other daughter had a ingrown toenail on both feet, and Dr. Nguyen took care of that. So we just came back to it.
Have you tried to wear your heels yet?
Yes,
She has.
I have.
She wear her heels. Okay, so like we are like 3 months out the right foot, 1 month out of the left foot, and she already get back to what
Yeah.
Right.
Okay, well that's a very good thing. I didn't even know about that. I just like randomly asking questions.
Yep.
Well, that's a good thing.
All good.
Well, this procedure is well known to realign the whole entire joint, and we'll be able to do that with Nicole. That is actually helping her in the long run, because with the custom orthotic, it's just like temporary, just what I usually tell patients, just like putting the band-aid on the problem. Because the underlying that she start develop with all different deformity on her front of her foot already. So with this, it's not gonna be like that. So at least that is a good solution to take care of this. After this, is not that, we're not gonna see you anymore. We're still gonna follow up every like 2 or 3 months. Just make sure that how your progress. As the springtime comes, you resume your sport activities, and so that we're gonna follow up with that as well. Okay.
All right.
Yeah. So it's a little different. Everybody coming with different complaint. Most of the time with the flexible flat feet, the patient never have any ankle pain, most of the time. But it's developed on different area of the ankle. So like for Nicole, it's a bunion and hammer toe. Some people have heel pain. Some people have plantar fasciitis problem, so it's all different conditions. Some people have knee pain. So it's completely bypassing the ankle at all. And so by properly evaluating, that will be able to get that corrected. So do you have any thing that you want to share to whoever out there may think that they have foot problems and, don't afraid of do surgery or something like that?
It's definitely worth it. It's very simple, very easy, very quick recovery. So I say go for it.
Very good.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908-576-0880 or visit feetandbeyond.com.